I'd like to spend a few minutes talking about patient expectations and what you should be looking forward to or sometimes dreading after your hip replacement surgery. In general, the surgery takes about an hour and a half. We have patients up to the floor at the hospital or at the surgery center walking the same day of surgery. Typically, you only go 25 to 50 feet, but you'll be able to get up and walk. The next day, you're going to be up walking twice with physical therapy. You'll have a walker. You'll be taught how to get in and out of bed, how to get to the bathroom. Basically, we want to make sure you're independent before we send you home. If you reach your goals the first day after surgery and your pain is controlled and you're independent, you'll be able to be discharged. The restrictions I put on patients is for the first 6 weeks, I do not like you to cross your legs over your knee. And the second is no sleeping on your stomach. These are my two restrictions for anterior hip replacement patients. Other than that, you can sleep on your side, you can put your socks on, you can walk, and what we want you to do is frequent small walks during the day and gradually build up your strength so that you can get rid of the walker or the cane by 1 to 2 weeks. The question of when can I drive, that happens when you're not taking pain medications and you can stomp your right foot on the ground. That mimics slamming on the brakes. Once you fulfill those two requirements, you're able to drive. Quite often we have patients driving themselves to their 2-week post-op appointment. Sometimes there's still too much pain or they're not comfortable enough, and patients will wait to the 3 to 4 week mark. During the first 6 weeks after hip replacement, in general, the bone is growing into the prosthesis. So on the acetabular side and the femoral side, we want to avoid any harsh twisting, turning, pivoting kind of activities because we want the bone to grow in. Once that does, then the hip is stable, generally at the 6 to 8 week mark, and we see you back in the office, and at that point, I'll get you back to walking, yoga, hiking, eventually water skiing and skiing, all those activities. I don't put any restrictions on my hip replacement patients except running. Hip replacement is not meant for running. If you have to run across the street or run out to get out of the way of something, that's okay. But high impact, frequent running could lead to early wear of the prosthesis, which we don't want that to happen. We want your hip to last for 30 to 35 years. Thank you for taking the time to watch this video. If you have any further questions, please contact us at 602-631-3161.